Hi and welcome. I'm trying to learn medicine. Today, Addison's disease. And after we've done it, we're gonna do short impingement training. And if you participate in the short impingement training, then it's at your own risk. And we're talking about diseases and internal anatomy. And this is in no way a medical advice, we're just learning. Addison's disease. It is a very rare disorder in which the body becomes incapable of reacting to physical stresses because the adrenal glands, the glands which control the metabolism of salts and sexual organs, cease to work. Okay, there is the adrenal gland somewhere, probably in the brain, and it is controlling the metabolism of the salts in our body and the sexual organs, and that adrenal gland doesn't work properly anymore by Addison's disease. Symptoms often come on gradually and may be difficult to recognize. But if early symptoms are neglected, the first apparent symptom may be sudden collapse. Okay, symptoms. Increasing weakness and tiredness leading to complete exhaustion. Okay, increasing weakness and tiredness and then exhaustion. Loss of appetite, nausea and abdominal pain. Fainting on standing caused by low blood pressure. Darkening of the skin, accentuated by sunlight. Dark patches inside the mouth. Collapse after minor physical stress such as slight infections or injuries. Duration. The condition is permanent and drug treatment must continue indefinitely. Causes. Destruction of the outer layers of the adrenal glands by autoimmune processes, that is, the body's own defenses somehow react against the gland's tissue. Okay, the cause is an autoimmune process. The body attacks its own adrenal gland. And that causes the symptoms of increasing weakness and tiredness, loss of appetite, nausea, I don't know, is this vomiting? Nausea, and abdominal pain, fainting, and darkening of skin, dark patches in the mouth, collapse after minor physical stress or after slight infections or injuries. Addison's disease. The adrenal gland doesn't work properly anymore because the autoimmune system attacks itself. The immune system attacks itself, so autoimmune process. And rarely can it be because of a tuberculosis infection. Complications. Failure of the circulation from low blood pressure. Okay, the blood system doesn't work properly. I don't understand the sense. The blood system doesn't work properly anymore. And another complication is severe infections such as pneumonia, so infections of the lung. Treatment in the home. None is advisable until the condition has been diagnosed. Okay, let's read on. Once the condition has been diagnosed and stabilized, close collaboration between patient and doctor is required to manage the disorder. Sufferers must learn how to regulate the dosage of the drugs they take. So I want to say again, this book is 40 years old. What we're saying here, that the people have to take them, that there is permanent and drug treatment has to be done indefinitely, and the people have to work together with the doctors to get the dosage right. When to consult the doctor? As soon as any of the above symptoms occur. So increased weakness, tiredness, leading to complete exhaustion, loss of appetite, nausea, abdominal pain, fainting on standing caused by low blood pressure, darkening of the skin accentuated by sunlight, dark patches inside the mouth, collapse after minor physical stresses such as slight infections or injuries. And also consult the doctor once management of a condition has begun. The doctor should be consulted if there are any unusual symptoms or problems. So a close working together with a medical qualified person. What the doctor might do: arrange for blood tests to confirm diagnosis. So arrange blood tests to look that it is Addison's disease. Refer the patient to a hospital specialist. The specialist will probably admit the patient to hospital for further tests to show the levels of salt and extent of steroid hormone deficiency. That is interesting. They said here, metabolism of salt, Addison's disease. There was another disease where we solved was differently, which I heard about. And certain pairs measured the level of salts and also other steroid hormone deficiencies. If Addison's disease is confirmed, special steroid tablets will be prescribed to replace the gland's own hormones. Okay, the people are taking the steroid tablets because the adrenal gland isn't working anymore. Outlook. Addison's disease is readily controlled with tablets that replace the hormones produced by the adrenal glands, and with treatment the outlook is good. If undiagnosed and untreated, the condition can cause eventual circulatory collapse and death. Okay, the outlook is, this is 40 years old again, that it should be treated. If not, that can lead to collapse and death. If it is treated indefinitely with tablets, then the outlook is quite good. Okay, that was Addison's disease. That was the medicine part. If you were here for medicine, then you can go directly to the next part. We will do now short impingement training. If you participate in the short impingement training, then it's better on the screen. Put this in the stand, and we're doing shorter circuits. We go back, up, front, and down. And backwards. And now advanced short circuits, long arms, strong fists, and go as far back as you can. As high up as possible. Front, and down, and back. And down and up backwards, up and back, down, front, and down. Now the world lifter. Go to settled stance, long arms, strong fists, bring the shoulders down and together. Now turn the arms to the inside. Shoulders down and together, arms to the inside. Now the arms to the outside, shoulders still down and together. And the arms to the inside, shoulders down and together. And change last time, arms to the outside, shoulders down and together. And release. Next exercise, arms to the side, hands onto fists, arms a bit in front, turn the arms in front, and shoulders down together. Now the arms back, shoulders up and in front. And the arms in front, shoulders down and together. And the arms back, shoulders up and in front. And release. Now a shock. Lift the arms up. And shock, shoulders up. And release it all down. If this exercise causes pain, then don't do it. Again, the arms up. Shoulders up. And now down. Again, the arms up. Shoulders up. And all down. And now, the sun dive. Press good. Sun dive. With a long arm, something at the outside, a tennis ball or sock or t-shirt, and fall down, catch it again. And now with your arm. And now just stretching one arm in front, shoulder is back and down, pull the arm in, have flat fingers, try to relax the arm, go a bit back with the shoulder, turn the palm a bit up to the sky, And with your arm. The arm in front. Shoulder is back and down. Hold the arm in. Have flat fingers. Try to relax the arm. Go a bit back with the shoulder. Turn the palm up to the sky. And that was the shoulder training. I thank you very much and have a nice time.